Data indicate that between 4% to 13% of all adult men in the United States practice homosexuality or dual sex, and that more than 12 million new patients develop sexual diseases in the anus each year. Types of diseases. 1. Disease gonorrhea. Gonorrhea, a bacterium capable of sexual organs injury. Lead to itching, pain, wounds and local purulent secretions. Men get infected as a result of having anal sex, while women may get local infection as a result of having sexual intercourse through the vagina. The disease is diagnosed through culture and treatment is by means of antibiotics, penicillin. It is important to remain under medical supervision to prevent recurrence of the infection and treat it if it occurs in a spouse. 2. Syphilis. This disease affects mainly homosexuals. And it leads to a hard sore that appears several weeks to months after infection. It is diagnosed by a direct smear test or by a blood test, serum antibodies. The treatment is done with penicillin. 3. Chlamydia, lymphogranuloma venereum. Lymphogranuloma venereum, inflammation. Straight TD3. Chlamydial proctitis, microbe within cells, of intracellular microorganism, causing pain, net or bloody discharge, or sores around the anus and enlarged lymph nodes in the groin. The diagnosis is determined according to the blood test or the results of transplantation from the affected tissues. As for treatment, it is done with antibiotics. 4. Herpes simplex, a virus that causes irritation, pain and the formation of vesicles filled with a clear liquid. The diagnosis is made according to the appearance of the vesicles and according to the results of transplantation from the fluid. The risk of recurrence and recurrence of the disease is very high. 5. AIDS. Acquired immunodeficiency syndrome. AIDS is caused by a virus that is transmitted through sexual contact or blood. It leads to the failure of the immune system and thus to the occurrence of systemic infection and infection in the anus, including the above types of infections. In addition, inflammation in the anus arises because CMV, cytomegalovirus, show ulcers occur directly because of the virus, the HIV itself. Therefore, it is important to have an AIDS test for every person who has an STD in the anus area. It must be remembered that these patients may have anus carcinomas. There is still no vaccination that prevents the disease or a treatment that leads to a complete cure from it. 6. Anal warts, condyloma acuminata. Virus, HPV. Human for papilloma by virus. The HPV virus leads to the emergence of pests, lesions, numerous, small and whiter, remember Balkernbit, around the anus and sometimes in the rectum, irritations, localized bleeding. The treatment is cauterization, excision with electric scalpel, or laser excision. The probability of recurrence of lesions is very high, and it could turn into a malignant carcinoma, squamous cell carcinoma.